So, moving on to our next anemia is megaloblastic anemia. So, here is the histological illustration of this anemia. For reference, these are the normal RBCs, and here you see there are large cells that are oval shaped, so we call these macroovelocytes, and these cells are hyperchromic. This is the main characteristic feature of megaloblastic anemia, hyperchromic macroovelocytes. And here you see there is considerable difference in the size of RBCs, so we call it anisocytosis. Also, you observe that there are different kind of shapes of RBCs, so poikilocytosis is also present. Now, observe this cell. This is a neutrophil, but it is not normal. Let's compare it with the normal neutrophil. We can see normal neutrophil have 3 to 5 lobes, but here there are multiple nuclear lobes, so we call it polymorphonuclear cells or hypersegmented nucleated neutrophil. Remember, all of these changes are present because there is insufficient differentiation of nucleus of these cells because of the deficiency of vitamin B12, and there is nothing wrong with the differentiation of cytoplasm, and these are called megaloblastic changes. Look at this. These are the cells which contain insoluble clumped ribosomes, which are called oval jolly bodies. Because there is so much formation of these abnormal cells, the spleen cannot clear all of these abnormal cells. So some of the fragments of ribosomes are still retained in these cells. So this shows oval jolly bodies formation. The next point is the reticulocyte is low. As you see, there is no reticulocyte in this slide. The reason for this is that due to vitamin B12 and vitamin B9 deficiency, the bone marrow cannot mature the normal erythroid progenitor cells into reticulocyte. So there is less formation of reticulocyte and there is less release of reticulocyte in bloodstream. Also, due to anemic response and increased erythropoietin level, the bone marrow tries to form more RBCs, and in this process, many abnormal and fragile reticulocytes are formed inside bone marrow and they die there before they make their move into bloodstream. So there is low reticulocyte count. Also you see there is tear-like cell which is called teardrop cell or dacrocyte, and there is occasional formation of normal RBCs which is called normocytes. And this is the real histological slide of megaloblastic anemia. These are the normal RBCs, these are the macroovelocyte or macrocyte. Here you see the polymorphonuclear or hypersegmented nucleated neutrophils. Here is the teardrop cell or dacrocyte. There is no reticulocyte in this slide. Here you see oval jolly body formations, and here changes in size or anisocytosis, and here changes in shape or poikilocytosis. Now let's discuss the bone marrow changes. The most important feature is that the bone marrow show hypercellularity because there is anemia undergoing. There is increased formation of precursors of normal RBCs which is called megaloblast. These are called megaloblasts because you can see that mega means it is a large cell and blast mean these cells are still in their immaturity form which is blastic stage. So these are megaloblasts. The growth of the cytoplasm is normal because vitamin B12 deficiency or vitamin B9 deficiency doesn't affect the cytoplasmic growth, but the differentiation of nucleus is affected. So you can see that chromatin is present in a reticular formation or in a specific network formation, which causes enlargement of the nucleus in these cells. So these are called megaloblasts. There is increased erythroid precursors formation because there is increased demand of RBCs. Also, the rest of formation of other cells is decreased because of the suppression effect of increased demand of RBCs on other cells. So we can see that there is decreased myeloid precursors formation such as granulocytes and agranulocytes. And this phenomena of decreased formation of all the normal blood cells of body is called pancytopenia. So my question is that, is there no formation of other cells? The answer is no. There is formation of other blood cells, but these cells are abnormal, like giant metamyelocytes, which is an abnormal precursor of granulocyte. Also, there is a formation of large bizarre megakaryocytes with multilobulate nuclei and clear cytoplasm. Here you can see in this slide. Now for the last part of our morphology of this megaloblastic anemia, let's discuss the RBC's indices picture of this anemia. The mean corpuscular volume or MCV is raised more than 120 because you can see that the RBCs here are large size compared to the normal RBC. The mean corpuscular hemoglobin or MCH is raised. It is because there is no deficiency in the formation of hemoglobin in this case, and the overall size of the RBC is increased. So now hemoglobin is covering abnormally large cytoplasm instead of normal small cytoplasm. So MCH is increased. The complete understanding of these RBC's indices is discussed in our separate video. Watch it for crystal clear concepts. And the last part is MCHC or mean corpuscular hemoglobin concentration is normal or reduced. It is because as the size of RBC is increased, the amount of hemoglobin or the concentration of hemoglobin is still same. So mean corpuscular hemoglobin concentration is reduced. And that concludes our section of megaloblastic anemia.